Hi, welcome to Professional Certifications channel. Let's break down NCLEX exam preparation, one topic a day for focused and effective learning. Today's topic is postoperative care.
What is postoperative care? Postoperative care refers to the medical and nursing care provided to a patient after surgery. The goal is to promote healing, prevent complications, and ensure a smooth recovery. Effective postoperative care involves monitoring vital signs, managing pain, preventing infections, encouraging mobility. Proper care can significantly impact the patient's recovery and overall outcome.
Immediate postoperative care. Immediately after surgery, the patient is transferred to a recovery area where they are closely monitored. Here's what to do. 1. Monitor vital signs. Check the patient's heart rate, blood pressure, oxygen saturation, and respiratory rate frequently. 2. Assess the surgical site. Look for signs of bleeding, swelling, or infection. 3. Manage pain. Administer prescribed pain medications and assess the patient's pain level. 4. Ensure airway patency. Make sure the patient's airway is clear and they are breathing comfortably. 5. Monitor for nausea and vomiting. Administer antiemetics if needed and keep the patient hydrated.
Step-by-step guide to postoperative care.
Now, let's walk through the steps of comprehensive postoperative care. 1. Pain management. Administer prescribed pain medications on schedule. Use non-pharmacological methods like ice packs or relaxation techniques. Assess the patient's pain level regularly using a pain scale. 2. Wound care. Keep the surgical site clean and dry. Change dressings as prescribed and monitor for signs of infection, e.g., redness, swelling, discharge. Teach the patient and family about proper wound care at home. 3. Encourage mobility. Help the patient move as soon as possible to prevent complications like blood clots and pneumonia. Start with simple exercises like leg movements and gradually increase activity as tolerated. 4. Monitor for complications. Watch for signs of infection, bleeding, or blood clots. Monitor for symptoms of deep vein thrombosis, DVT, and pulmonary embolism, PE. 5. Provide nutritional support. Ensure the patient is hydrated and eating a balanced diet to promote healing. Offer small, frequent meals if the patient has a poor appetite. 6. Educate the patient and family. Teach them about the signs of complications and when to seek medical help. Provide instructions on medication management, wound care, and activity restrictions.
Tips for effective postoperative care. Here are some additional tips for effective postoperative care. Maintain sterility. Always use sterile technique when handling wounds and dressings. Monitor fluid balance. Keep track of the patient's intake and output to ensure proper hydration. Encourage deep breathing. Teach the patient to perform deep breathing exercises to prevent respiratory complications. Document. Record the patient's condition, interventions performed, and any changes in their status. Provide emotional support. Surgery can be stressful, so offer reassurance and address any concerns the patient may have.
Common mistakes and how to avoid them. Even with the best intentions, mistakes can happen. Here are some common errors and how to avoid them. Inadequate pain management. Regularly assess the patient's pain and adjust medications as needed. Poor wound care. Follow proper wound care protocols to prevent infections. Ignoring signs of complications. Monitor the patient closely and report any concerning symptoms immediately. Lack of patient education. Ensure the patient and family understand the care plan and follow-up instructions.
Conclusion. To wrap up, postoperative care is a vital part of the recovery process that ensures the patient heals properly and avoids complications. By following the steps and tips we've covered, you can provide effective care and support for postoperative patients.